So whether that means it's in the chat or you unmute, I really encourage both. And if there are questions that come up throughout, please feel free to drop them in the chat. I'll either answer them in the moment or at the end. But ideally in the moment, because I really don't want this to feel like a completely like didactic experience, but more of like a conversation. Um, okay, let's see if this shares. Can everyone see that okay? Great. Okay, I'm gonna move this here and show grid. Let's see if I can get everyone. Oh, I can. Look at that. Okay. So to tell you a little bit more about who I am, I like to share this so then that way you can understand maybe a little bit more of like the perspective that I bring to this presentation. So I'm from Phoenix, Arizona originally. I identify as a queer, white, Middle Eastern man. Um, I went to Washington State University for my doctoral degree and Arizona State University for my bachelor's. I currently live in Honolulu, Hawaii, and moved here about 4 years ago to finish my doctoral degree and decided to stay here now that I've really integrated into the community and do a lot of queer related work here. And I've loved it, so I've stayed. So it's super early for me in comparison to probably a lot of you. And I'm a clinical psychologist. Like was said before, I specialize in LGBTQ health, and I also currently am a research scientist at the Trevor Project. And in my free time, I like to spend time with my partner, my community. I have a 13-year-old grouchy cat named Anna. She's amazing. I like to surf, I like to hike, and I also love horror films and have loved SpongeBob since I was a child. So that's just to tell you a little bit about me, both professional and personal. So to get us started, I'm actually going to ask you all a question, and hopefully I'm going to see where the chat pops up. I'm not sure where it's going to. But why do we need to discuss this topic in particular, especially when we're thinking about LGBTQ youth? And again, it's about assertive communication and consent, which involves like boundary setting as well with sexual interactions and relationships in LGBTQ youth. So why are we having this conversation? Why is it important with this population specifically? Okay, I see a chat. It did pop up. So that youth can stand up for themselves. That's great. What else? Again, feel free to put it in the chat or unmute. Either one's fine.
All right, I'm always a sucker for silence. I can't help myself. One of the first things that popped up in my mind was kind of the hypersexualization of LGBTQ people and the idea that sexuality is just what they are, and the
Mm.
idea that consent's very much a human thing, regardless of identity.
I love that you said that. And I feel like that's actually not talked about enough. Um, Queer people, while we identify most often with maybe a sexual orientation, which adds this layer of sexuality onto us, then people perceive us as only that. That conversations that kind of help people understand queer youth beyond just a sexual orientation, super important. Yes. Um, Also, this population is a vulnerable group. There's a need for more understanding and education about consent and boundaries. Yes. Great point. And advocacy regarding their health and conversations with healthcare providers and cancer prevention services. All really good points. Thank you for starting the conversation. This conversation is super important for queer youth for a lot of reasons, many of which you've already stated, and I'll share a couple more too. So queer youth, as many of you already know, that they're often overlooked in sexuality and consent education, meaning a lot of the education that's provided is general and not LGBTQ specific. There's a lot of documented evidence that sexual health education, consent education is essential for well-being in youth, especially LGBTQ youth. Being able to help individuals have good communication makes for respectful exploration of sex as well as other people's bodies, if it gets to that. And specifically with queer people, which we'll talk about later, there might be specific things that come up for queer people more often than their cis-het peers that are really important for consent. And especially when we're thinking about individuals who have experienced things like sexual trauma or gender diverse folks like trans and non-binary people who may have very conflicting relationships with their bodies, which changes the way that we may navigate consent. Queer people also have diverse relationship dynamics and unique legal challenges, which we'll talk about as well, surrounding consent. Consent also can change online and in digital spaces, and since that's used more often for queer youth, good to talk about how that might change for those spaces as well. Misconceptions and stereotypes about queer people can impact communication and consent too. So like what was just stated by Russell, we can over-sexualize someone, and that might also change how that person approaches a consent conversation. So making sure that those misconceptions and stereotypes don't change the way that we navigate consent, and that we don't over-sexualize a person simply because they're queer. Higher rates of non-consensual sexual interactions, like I said before, so higher rates of sexual trauma. And then there's also challenges in communicating needs often due to a fear of rejection, which we'll dive into later too. So if there's a high fear of rejection, we may avoid consent conversations because we don't want to feel uncomfortable or rejected by asking a question of whether or not someone's going to be interested in doing something with us. And I believe this is the last one on this slide, but more minority stress, that's a fancy term for stress that individuals in that are not in like a majority group that they experience based on their identity, which impacts health issues. And those can both impact bodily agency or how one navigates consent, how confident they feel navigating these things with other people. So there's lots of reasons why we need to talk about this in general, but specifically with queer youth. Um, just kind of a quick tidbit to start us off. Assertive communication, boundary setting, and consent, they're essential. They're fundamental human rights to have healthy versions of all of these. They provide a framework for establishing respectful, healthy, and empowering relationships. They also contribute to the overall well-being of individuals by fostering communication, agency, and mutual respect between people. And this is for all people. Quick outline, what we're going to talk about. So assertive communication and consent is how it's going to be broken up into two different parts. And throughout, there's going to be some education as well as opportunities to interact, answer some questions, and maybe even have some not difficult discussion, but discussion surrounding maybe some difficult topics and figuring out maybe if we can provide some clarity on those, especially in regards to things like gray areas when it comes to consent. But overall, just understanding and empowering through respectful interactions is really what this is about. So to start off assertive communication, I'd love to hear from you all. Again, unmute, jump in the chat. What is and isn't assertive communication? And you can answer either of those because I think it kind of, by answering either, you're kind of defining what it is. Assertive communication isn't just shutting down the other person. Love that. Okay, tell me more, whether that's Ivy or someone else. What it is, it's respectful, direct, and clear. Great. Being clear and direct, but that can be both verbally and non-verbally. Thank you for saying that. Non-verbal cues are super important with this type of communication. Non-passive, meaning, yeah, great. It's not passive, it's more direct. It's honest, communication of sharing needs and thoughts. Yes, you're prioritizing your own needs and thoughts, but you're still being respectful of someone else. All great contributions. It's both what I want and don't want. Yes. So these are the things that I want. These are the things that I don't want. Awesome. These are all great. So to further define it, and then to use an example. So there are 4 different types of communication that we typically talk about. You've probably heard of these before. There's various degrees of like how much openness and consideration for others are at each of these levels. So when we think about like aggressive communication, there's low consideration of other people. Passive aggressive is similar. Uh, and if you look at also like the openness of communication, aggressive is open. It's just not considerate or respectful. Assertive is both open and considerate. Um, Passive has lower openness, but it is considerate, meaning you might not be sharing fully what you think or feel or what you want. So when we think about like examples of each type, do you want to kiss me? If someone asks someone that. This could be either for us or people that we teach or anyone that we're interacting with. This just gives us some tools of like of how to identify different types of patterns. But a way that we might respond to this if we were responding in each of these. Passive might be like, not really, but I guess we could. That's more passive, meaning like you're not necessarily, you're wanting to protect their feelings and you're not necessarily really communicating yours. Passive aggressive might be, you think I would want to kiss you, which is kind of communicating what you're feeling, but it's a little bit more aggressive. It's actually not going to come across as something um, that they're going to be able to digest very well. Assertive might be, no, thank you, but I appreciate you asking before you attempted to engage. And aggressive could be something like, ew, no, I would never want to kiss you, meaning it's direct. It says what you want, but it might be a little bit more aggressive and not considerate of their feelings. So when we're thinking about navigating a yes or navigating a rejection, there are various ways we can do it. And there are ways that can be not only effective at communicating what we want, but also still respectful of what other people um, might hear best and feel best while hearing it. So some components of assertive communication. We've touched on a couple of these already. Uh, Self-expression, nonverbal communication, boundaries, and conflict resolution. So the first two that are super important. So self-expression, like we were saying before, someone already said this in the chat, which is great. It needs to be clear and it needs to express your thoughts and your feelings, regardless of what the conversation is, whether it's about sex or something else. Assertive communication is clear. So saying something like, I would like to do that. It's clear, it's assertive. Use of I statements rather than you statements. So instead of like, you're always pushing me to do things, an assertive statement would be more like, I don't like feeling pushed to do things. It's about you and your own feelings. Once we bring the other person into it, it creates more defensiveness and they're not going to hear you as well. So assertiveness is really about what you are feeling. Active listening is also part of assertive communication. Oftentimes people think of assertive communication as just stating what you feel, but it actually involves listening to and being part of a full conversation. So if for example, you're saying something to someone and you ask them what they're comfortable with, and it might not even be what you wanted to hear, active listening would be something like, got it, thanks for telling me what you're comfortable with. Or even repeating exactly what they said, like, oh, so you're telling me that you would not be comfortable with blank. Yeah, that is what I'm saying. Great, thank you for telling me that. Being consistent is also part of assertive communication, meaning not necessarily changing what you are feeling or thinking just in a way to kind of meet the other person where they're at, but being consistent and sticking true to your thoughts and feelings while still remaining respectful. So a way to do that would be like I said before, I don't like doing that. Would be a way to be assertive. Nonverbal communication, super important. So eye contact, very important in assertive communication. Shows someone that you are being serious about something and that this is something that they really need to be listening to. That can be really hard to do. It's easier said than done, but the more eye contact, the better. Body language is important as well. So when we think of body language, these are things like facial expressions, posture, gestures, proximity, how close we are to people, touch. These can all be used to communicate assertively, and they also should be things that we're aware of when we're communicating and we're engaging in active listening to see how the other person is responding. All of these things are very essential in knowing how a person might be feeling, even if they're not using words, or us communicating how we're feeling, even if we're not necessarily using words in that moment. Like I just said, understanding others' nonverbals are that's very important too. So watch for their eye contact and body language while a conversation like this is happening. Again, whether it's about sex or not about sex. And it's always good to also ask for clarification if noticing something. So for example, um, if we are navigating something new with someone and we notice maybe some body language, like a facial expression or some tension or increased proximity or something like that, and we're a little confused, it's completely okay to ask for clarification Even if the other person denies that anything is wrong, it's good for us to still ask. That way we can attempt to be reading their nonverbals and see if we're reading them correctly. These last two, so boundaries and conflict resolution. Boundaries. Before we start an interaction, especially a sexual interaction, now, again, this isn't only for us in the room, but we should encourage everyone that we're also educating about consent and assertive communication, the importance of communicating our rights and our boundaries before interactions. So rights, meaning everyone has specific rights to consent. It's a fundamental right. And then also our own boundaries as well. Like, what are things that we're comfortable with? What are things that we are not comfortable with? What are areas that we're okay with exploring, even if it's new for us, and being able to lay those before we start. Being firm and clear is super important if we're wanting to be assertive when laying boundaries. And also, it's important for us, if we hear boundaries, to respect those boundaries. And if there's ever a time where that boundary is pushed, for another conversation to happen to see how everyone is feeling about that boundary changing. I really like doing this, but I don't like doing this. Again, like what was said earlier, saying what I like and what I don't like, very important. Emotional regulation while setting and understanding boundaries is essential too, and something that a lot of people don't really gain a lot of practice in. Because again, if we're interacting with someone that we are attracted to or want to be intimate with, we might get rejected or feel rejected if there's something we want to do that the other person does not want to do. So teaching the person that's asking for consent about something and is then feeling rejected, helping them learn how to emotionally regulate and realize that it's not necessarily a rejection, but instead just another person sharing what they're comfortable with or not comfortable with, can be crucial in helping someone navigate consent conversations effectively. Like we just like I was just going over the importance of helping people deal with rejection. Just because someone says no does not mean that they do not like you or that they do not want to engage with you. It just might be not be something they're comfortable with. And sometimes you also may feel guilty for setting a boundary. That's something to really process of, like, why am I feeling guilty about setting a boundary, protecting my own needs? Am I afraid that I'm hurting them or that they're going to feel rejected? That does not mean that you need to change your boundary, but instead encourage that person or trust that that person will be able to work through their own sense of rejection rather than us changing our boundary because we don't want them to feel bad. That can happen often, especially with younger folks, allowing for things to happen because they feel guilty. And then lastly, conflict resolution. So if there is a conflict, whether again it's about sex or not, with assertive communication, it's important for us to advocate for our feelings and our needs, again, without blaming the other person. Advocate for yourself and only compromise when it feels safe or when you actually want to compromise. But being compromising and meeting in the middle can be really can be a crucial part of assertive communication. Again, making it feel like it's something that you're still comfortable with, though. Empathy towards other feelings and needs from the other person. Like I said, actively listening and attempting to understand, which does not have to change what you want, but instead just showing the person that you're hearing them. So listening and showing that you are listening, which can be shown through a variety of ways, like we were saying before, like repeating what they said, even using word for word, or summarizing what they said to show that you were really listening. And lastly, maintaining and not swaying. So again, even if you're feeling guilty, not necessarily changing just based out of guilt, but maintaining and sticking to something that you're comfortable with and not swaying for the other person, unless you want to sway, that is. So that was a quick review of some essential parts of assertive communication. So tell me other reasons or times when being assertive is difficult and why. So we talked about a couple. Any other times when this is difficult and why? Again, you can unmute, you can drop some stuff in the chat.
I was just gonna say that I really struggle with being assertive, and I just had a long weekend with a really good friend who is much better than I am at being assertive. And I think one thing I stumbled upon in talking with her was that there's sort of, I think as a woman, I identify as, or what I identified is that as a woman, I've kind of been fed this narrative of like girls aren't that way or women aren't that way, that they're
Hmm.
not meant to be assertive, and that that's rude, and
Yeah.
that that doesn't fit that like good girl narrative um that maybe we were raised with. So that was one thing that comes up for me, and when I'm trying to be assertive, is that, oh, I
Yep.
don't want to hurt their feelings, I don't want to come off as rude, I don't want to, rock the boat kind of thing.
Yes. I'm so glad you said that. So within even cisgender folks, gender is a huge part of assertive communication and who feels comfortable with it. So here I am, a cisgender man teaching about assertive communication, and I've had probably an easier time with it than you have being a person who is a woman navigating spaces where there's probably increased guilt or discomfort being assertive, or you've been told that you're not allowed to be assertive because it's not like quote unquote ladylike.
Right.
Absolutely.
Yeah.
And then this gets even more difficult when we're thinking of adding queer, like a queer lens into it. Then it's like queer people can often struggle even more with being assertive, or trans folks, because it can also lead to dangerous situations too. Um, so yes, very important for us to consider like demographics and how that impacts someone's comfort. And it's also, I think it's outside the scope of today's conversation, but when we look at like historically how that was developed over time, like how women have learned to not be assertive, it really all ties back to like ownership and capitalism, religion, like these huge constructs that have silenced women for years and years and years, the same constructs that have silenced queer people.
Mm-hmm.
So this is a way for us to like reclaim our power as
Yeah.
women, as queer folks, and to be assertive, be respectful, but still not lose our needs. So I really appreciate you sharing that. Um, Anything else you want to say to that, Christina?
No, I appreciate all that feedback. I think that, yeah, that's really helpful to think about it that way.
Yeah, thank you. There's also some things in the chat I just want to note. Growing up in a generation known for people pleasing, absolutely. Because people think they are hurting someone else's feelings and being assertive. They're worried about embarrassing someone else. Yes. What you will find is that when we are assertive rather than aggressive or passive aggressive, we're going to have a lot more success with not hurting someone. And even if we do hurt them, we have to trust that they're going to be able to get through it on their own. So trust that they're not fragile. They'll get through it. You don't need to bear the weight of that guilt. That person can bear the weight of feeling rejected or getting honest feedback and get through it. We don't need to fragilize them, especially if we're talking to a man, a cisgender man who's told us to not be assertive. They can sit with being uncomfortable. We don't need to fragilize them. Maybe if someone struggles with people-pleasing tendencies, yes, power differentials, totally. That can make assertiveness difficult. Have to navigate it very strategically. And when your partner holds more physical power and strength than you, or having been conditioned your whole life to bend to the other person's will to make them happy, something more assigned female at birth people are taught. Yes, this all fits together. These are great points. So thank you all for bringing it up. And I encourage everyone in here to reflect on their own level of assertiveness and ways to become more assertive when it feels safe to do so. And to also challenge like themselves in thinking about when did I learn to be more passive, and um like what is that tied to? Is it the patriarchy? Is it religion? What has silenced me over time, and how do I reclaim that power? Because assertiveness is just so essential, regardless of how we identify, to get the things that we need and that we deserve, especially if we're part of a group that's not in the majority. Um, some quick barriers to assertive communication that some that we've talked about, some that we have not. So internalized stigma and mental health can be barriers as well. So if we have a lot of internalized stigma, which is kind of what we were just talking about, whether that's like historical or whether that's something that's more individual, it's happened to us more recently, or we struggle with things like depression, anxiety, low self-esteem, those can all really impact our ability to be assertive. And having tendencies towards passive or aggressive communication, sometimes that's learned through modeling, oftentimes like through our parents or even in school. These can all be barriers. So learning how to become more assertive and also to process our internalized stigma, recover from mental health problems, that can make assertive communication easier as well. We're going to switch gears and just going to check the time. Okay, we're doing okay on time. Switch gears and talk about consent. And if I skip over anything here and there, that's just because I want to make sure there's enough time, but I think we're doing okay. Real quick, do I have till 11? Sorry, not 11. The hour. I do have till the hour.
Yeah.
Okay, perfect. Okay. So, what is, same thing as before, what is and isn't consent? Again, by answering what it is or what it isn't, we will be able to define it. And consent, this can be about sex, romance, friendships, hugs, anything. Is not assumed. Great. Consent is enthusiastic. Absolutely. An agreement and understanding. Consent is not coercion, so it can't be forced. One's communication of their willingness to engage in sexual activity or any activity that is contextual changes by person, time, power, or substance use. Yeah, I love that. All of those are important. Yes. All right, so here's some things that you already have touched on too. It's specific and reversible. I love that. Specific meaning I'm going to say exactly what I'm consenting to, and reversible meaning I can change at any point. It's not something that has to remain. Even in a single interaction, a single minute, it can change. Um, so must be informed. Megan, can you say what you mean by informed?
Yeah, so like you know what you're like agreeing to and maybe like the risks associated and like the protection measures that you can take in order to minimize those risks for like pregnancy or unwanted pregnancy or STIs.
Love that. And I think that that's probably an area that's not talked about enough. And when we think about uh, the amount of legislation right now that is trying to decrease information and how that would impact consent, very sad that individuals are entering these situations not informed, which then they may not even know what they are consenting to or not consenting to. Um, so it's when you say that, I think it brings up something for me that it's the fact that it's not even that they aren't consenting to something at times, it's that they don't even know what they are or not consenting to because they're so uninformed that they're not sure what's about to happen. So in these like trial and error experiences with queer folks, especially in regards to sex, where they don't really know what they are doing, there's often a lot of non-consensual sex that happens, but they don't understand that it was non-consensual until years later because they didn't even know what they were necessarily getting into, given that it was just exploratory. So I'm so glad that you shared that. Um, but yes, it must be enthusiastic, which means like it must have a presence of a yes, not just the absence of a no. And it must appear to be enthusiastic. The person really wants to do it. It must be clear, affirmative. So that's a positive thing, means that the person must feel good about it and say yes. Must be mutual between both people. Must be voluntary and willing, so it can't be coerced. Must be ongoing, like we were saying before, meaning that it needs to maintain and it can change. So if it changes, that no longer is consenting. And two other ones must be coherent and sober, which we'll talk about in a bit, and must also be of age, which varies depending on like state or country, but must be of legal age. Here's a graphic that some of you have probably seen before, kind of sums things up pretty well, with the presence of a yes, not just the absence of a no. I'd say the one thing that this is missing that people typically want to throw in here is that it's enthusiastic. And I also like the idea of adding if it's informed too. Consent isn't just sexy. So a lot of there was this movement that's like consent is sexy. And it's like, yeah, consent can be sexy. Like how sexy for someone to ask me if I'm into something, right? But it's actually not just sexy, it's actually required and it's a fundamental human right. So I think that there's this shift in conversation too about like not just being like, wow, this person's giving me the basic minimum and asking me for consent. How sexy. It's like, no, this is basic. It's required. It's a fundamental human right. And so shifting that conversation,
I have
I
a
would say, yeah, please
question.
go.
So I am thinking like about how enthusiasm looks different for different people, and in different contexts. So like if we're doing something for the first time, we might be like excited, but also really nervous. And that might like come across in our like body language and in our
Yes.
language. Do you have any thoughts on like on that, like the different ways enthusiastic, like is it always enthusiastic? Is it sometimes curious and like
Love that.
nervous? You know what I mean?
Yes, when I think enthusiastic, I think less like, yes, gung ho. And I think enthusiastic for me is like, yes, like I want to do this. Like I think of it as more strong because you're right. A lot of times when we're trying something, we might feel enthusiastic about trying it or excited, but we might also be nervous, but we're still consenting to it because we're figuring out, will I like this or not? And that's okay. Like we don't have to know if we're going to like it or not, but feeling safe enough to explore that with someone, and enthusiastically agreeing, not as like a being gung ho, super excited, but more committing to it and feeling good about that committal is how I see it. So great point.
Okay, thank you.
Yeah. Um, I also saw in the chat saying consent is sexy is sexualizing consent. Agreed. And when we're consenting to something, we're not having sex yet or doing that activity yet. We're talking about it. So it's not necessarily sexy. Then what happens afterwards might be sexy, but that is just a fundamental human right. It's required. Taking the sexiness out of consent and making it just a required conversation. 2 to 4 times more likely. So LGBTQ youth are, depending on the estimate that you look at, basically they're more likely to experience sexual assault or non-consensual sexual activity at like all ages compared to their peers. Heightened in transgender and non-binary youth, girls and women, and youth of color. And that's not saying that it doesn't happen in like trans men, cis men, oh, sorry, cis men. It happens actually more often in trans men, but it happens too to cisgender men, but less often than these individuals. But if the person is a queer identified cisgender man, so like lesbian, gay, bisexual, queer, that's happening more often than their non-queer peers. But it's just more likely to happen to queer youth. So similar to before, when is consenting or asking for consent difficult and why? Anything else here that we haven't talked about that comes to mind? Again, feel free to jump in, drop stuff in the chat. Anything that you feel like we haven't hit on yet? When it's difficult to either provide consent or ask for consent and why? When substances are involved, yes, huge. We'll talk about that. Thank you for mentioning that. Anything else? Any other times? It can be embarrassing to say no to something that's perceived as normal. I love that. Yeah. So if it's seeming normal to maybe the majority of the population, but we don't necessarily like it, we might feel embarrassed to say no to something. And if that's the case, I'd really encourage you to lean into assertiveness and realize, regardless of the fact that that's what other people want, I don't want it. And it's completely okay and doesn't need to be embarrassing for us to reject something if we don't want it. So I'm so glad you mentioned that. Sometimes we can feel pressure to do things because maybe other people are doing it. Non-sexual consent, it's really hard to say no to family. Like personally, I hate hugs. Great, love it. I don't love that for you, but I love this example because it's a big one. People just assume that everyone likes to be hugged. So figuring out and testing out the waters of like, how might I tell people I don't like hugs or that I don't want hugs and not feel guilty about it and trust that this person is strong enough to be able to handle the rejection, that I don't need to feel guilty for rejecting them and that they're not that fragile, that they'll get through this. And if they won't get through it, putting that on them, not on you. I know that's a shift for a lot of people, but I encourage us to lean into that. When it comes to personal health conditions or stigma related to personal information, example, a herpes or HPV diagnosis. Yeah, absolutely. That can change the way that we navigate consent too. Something that we would want our partners to inform us of or us to inform our partners of before we engage in a sexual interaction, because that kind of leans into what we were saying before with Megan about being informed about what we're entering, the risks involved, things like that. All great examples. Thank you so much. So what does consent look like and not look like? So it looks like asking permission before changing anything, or asking permission before we start as well. But if we're going to change, we can ask permission. Like, how would you feel if we did this? Confirming reciprocal interest, like, I'm interested in this. Are you also interested in that? Stopping at any time and making sure that both people know that we can stop at any time. Checking in throughout. How is this for you? Giving positive feedback. So as someone that is um, maybe trying something new and the person doesn't necessarily know how you might be feeling, being able to say, I really like this, or I liked when you did that. That can be really helpful for the other person to know what you like and what you don't like. Not only negative feedback, like critique, but positive feedback. Explicitly agreeing and giving and reading physical cues to advance. So sometimes we might not use words, but we might use nonverbals to be able to also provide consent to change things up, whether that's body language or eye contact or touch or whatever we might be doing. Consent does not look like these things. Refusing to acknowledge a no, obviously. If someone's disengaged, non-responsive, or seemingly upset, that's not what that looks like. That we need to check in. Assuming an invitation based on whatever, based on someone's clothing, based on their identity, whatever it might be. Being underage or under the influence of substances. Being intimidated or pressured in any way, and assuming permission because of the past, which is a really big one. So just because it's happened in the past does not mean that that needs to happen today. This can be a big one for people in long-term relationships or marriages. So people often ask, like, can a rape happen in a marriage? Yes, absolutely. Can non-consensual sex happen in a marriage, a happy marriage? Yes, absolutely. Because there can be this assumption that permission is there because these people are together and consent might change. So it's good to check in again and relay boundaries if things change. This is super important too. So this confuses individuals at times when their body might be responding differently than their head or their desires, how they feel inside might not align. So physiological responses, whether this is like an erection, self-lubrication, arousal of any type, orgasm, these are involuntary. So your body might react one way, even though you're not consenting to the activity. In no way does a physiological response at all mean that you consented to what happened. So just because you have maybe your body experiences even a sense of pleasure at times during something like this, and a non-consensual sex interaction, that does not mean you consented. Your physical response is different than your emotional, cognitive response. So non-consensual sex, rape, and assault is also never your fault, especially like in these situations where you're having a physiological response, even though you don't want to be doing it. So that's always important for us to make sure that individuals who are like survivors of assault or rape know that just because you had a physiological response, if you did, that does not mean that you consented to the activity and it is not your fault. Some gray areas. This is going to tap into something that was said in the chat, and I think these are really important. I'm going to put them all here. We probably aren't going to get to all of them. I want to make sure we have enough time, but the idea of being drunk, inebriated, or taking substances before having sex, which can happen more frequently with queer folks. So how is consent established here? Does level of intoxication matter? What if one person feels good about it and the other one doesn't the following day? These are all questions that I want us to think about. So before we move on to the second questions, let's start with those. Any thoughts on how consent is established in a situation where there's drinking involved, substances are involved? Can consent be established? Can consent not be established? Does level of intoxication matter? What if feeling changed the next day? Like, just immediate thoughts on any of those questions. We're not going to be able to fully dive into all of them, but I just want us to start thinking about it. And we can get into those other questions in a minute too. But anyone have thoughts on that? Consent when substances are involved. Okay, let's see. Okay, Wish you had asked a couple of Supreme Court justices this question. Yeah. I think that consent is not guaranteed if you're not sober. No consent cannot be established. Okay. And I'm curious for Ivy, Tamika, since you dropped those in the chat, do you think that level of intoxication matters, or do you think that once any substance enters the system, that no longer like consent can be established? And that can be anyone asking.
I'm
Yeah,
sorry.
yeah. No, jump in.
Yes, I think that as far as levels go, if it's you and your partner and y'all have and y'all, let's say y'all drinking together, then that's different. You know what I mean? Like it's like you and y'all, it's y'all together.
Mhm.
And y'all, you know, this is what this might be a habit of y'all. This might be something that y'all do. So, you know, but I also think that if you're like going out to a party and you hook up with somebody and you both are drinking, no one really can give consent in that moment. I don't think neither party can give a consent that is of sound mind in those particular moments.
Yeah,
So I don't think there is levels to it when it comes down to it, because once again, this is somebody I just met you. You know what I
yeah.
mean? So no, I don't. Mm-mm.
I love that. So you're saying for you, it depends on how those two people are related as well. Like
Correct.
it, it could that could change how consent might be navigated.
Correct. Yes.
Okay, it's a great point. So someone said in the chat, if you can't drive, you can't consent. So like maybe it's like a couple drinks or less. It's like say someone has a drink. Can they still consent? They're maybe they're a little looser, but they're still coherent. But maybe two or three drinks in, they're less coherent. Maybe that changes things. Or like we were saying, maybe how those two people are related changes things. And I think with this type of conversation, every single one of us in here is probably going to have a different response. Meaning we might have some overlap, but there might be intricacies for each one of us where we feel like consent can or cannot be established in these situations. That's why it's gray. And so I think it's good for all of us to reflect on for ourselves how we think consent can be navigated if substances are involved. Does that mean I can't consent at all? Does it mean I can if it's with my partner? Does that mean I can after, a certain level of inebriation? Disregarding the legal aspect for a second, because we'll talk about that more just for our own selves. If we have, if we engage in sex with someone under the influence of substances, what do we feel comfortable with personally in regards to consent? Another question here is, what if one person feels good about it and the other doesn't the following day, even though in the moment it felt like both people felt good about it? Does that change how consent worked in the moment? And again, we don't have to have an answer, but something to think about. We both wake up the next day. One person liked the activity, the other person did not like the activity. But in the moment, there were substances involved, and they both seemed to feel good about it. Any thoughts on that?
Feel like there's like a lot of opportunity for aftercare, which is
Yes.
something that I am sort of new to. But like checking in with the person and like leaving room to for both parties to like share their own experience and then hear and then do that like active listening of like, oh, that didn't work for you or that didn't work for me. And like, I don't want
Yeah.
to do that again. Like, I don't want that to happen again. And like validating those feelings in the after, like, yeah, the
Yeah.
next day or the even in the next week or something, like revisiting it, especially if it
Yes.
felt weird. I feel like this is like these are questions that are really tricky, especially when working. We have like some younger folks on the call who are like in high school still, and like um, the reality of underage drinking is a thing, and also brains are still developing, and like
Yeah.
and like there's like lots of like trying new things, and the culture that we live in is so like
Mhm.
there's like lots of binge drinking that happens sometimes, and
Mhm.
like that makes me nervous. So
Yeah.
for like experimenting in both areas at the same time, that can feel like a lot of danger zone.
A lot of danger zone. Absolutely. There's also the aspect of using a substance to be less inhibited, but then being too altered to say or do it. Yes, absolutely. So knowing our limits as well. Good point, Robert. And
Can
I
I
loved your point, Megan, about
can I ask
aftercare.
a question? Megan, who was the young woman that did an entire, she had a whole entire webinar about intoxication and consent. I had a huge flashback when this slide came up. Like, I wanted to add like an asterisk because that was kind of her whole thesis in investigating college students and hookup culture and intoxication and consent. And for
Tiffany
the
is
life,
on the call with us.
what's that?
I said
Tiffany,
Tiffany is on the call with us. She
Oh, right on. Yes, that was fantastic research. That, yes.
and if you were not on that call, that is on our YouTube channel. So if you want to go back and revisit those conversations,
Sweet.
that's another yes. There.
love it. Hi, Tiffany.
Hi, Stephen. Yeah, no, it's a great question. It's so, like watching this, like it's so interesting because we just have data right now about young people are talking about the next day is how they determine that an alcohol involved experience was consensual.
Yep.
And this whole thing that they're having with each other about like when they wake up and like, was this okay? Was this not okay? Did you like this? And so,
Yep.
from like an ideal stance, I would prefer them to have that, prior to sexual
Yep.
activity happening. But this is what they are saying that they have these conversations the next morning, and that's how they're navigating this. And sort of
Super.
and trying to understand it. So I appreciate the question because it is what they're talking about.
Yeah, I love it. And I think the importance of aftercare, like what we're saying here, it's essential here. And this is an ever evolving conversation. I love that you're gathering that data, listening to what they're saying, and I hope that more and more of that can be done because I don't think that we're just going to eliminate sex under the influence of substances. It's not going to happen. So it's like, how do we do this in the most respectful and safe way? So great. Last questions here, which we're not going to go over, just things to think about. How to handle the above scenario if there's a situation where someone feels I did not consent to that, even in the moment it felt like maybe I did. If the perpetrator or the person that engaged, that felt maybe better about it, but maybe pushed boundaries a bit, if they did not mean harm, but they need to adjust behaviors, should that be handled in the same way of someone that is overtly sexually assaulting someone or raping someone? Is it different? It might be, it might not be. Are there non-punitive ways to navigate these gray areas, or is it black and white? I think it's pretty gray. And again, each one of us might have different feelings here about how to navigate this, but just thinking about like, this is an ever evolving conversation, not an easy one, but just things to think about. Just looking at time, because I want to hit on these last points. I'm not going to get to everything, and that's okay. I can send these slides out. But consent conversations, a lot of these things we've talked about already. It involves a yes. Body language is something to look for. Verbal cues as well. Asking prompting questions and getting responses and being open to rejection. These are all examples of things that can be said during consent conversations. Like before we start, let's chat about how we're feeling and what we'd like to do. Actually, I think I'd rather do this because I really like this. Or I'd like to stop. Or it's okay if you're not into this, we can do something else. What do you think? I want to make sure you want to do this. Should I keep going? How does this feel? All examples of things that can be used in consent conversations. These are questions that, things of like, how might we respond to these? That could be important to think about. Like if someone asks us, do you want to do this with me? And if I want to, what might I say? What might I not say? If someone starts pressuring us and says, a good partner would at least blank with me, how do we respond to that? Like, how do we want to be assertive? We might feel pressured or guilty, or, how do we prepare if we're in a situation, prepare for a situation where we're being pressured? If you really love me, you'll just do this thing with me because I really want it. Come on, just this time. It will be okay. Trust me. I bet it will only hurt for a little bit. It's going to be okay. It's less sexy if we talk about it first. I like just doing it. These are all things that someone might say, and we might want to know how to respond. Last things here. Again, I'll send these slides. Things that can influence consent. We've talked about this a little bit already. Power dynamics, communication styles, and identity and culture. Power dynamics. Who's in top power, who's in the bottom power in that situation. Communication styles. Is there someone who's more aggressive or assertive and someone who's more passive? Identity and culture. Individuals with specific identities or from specific cultures might have more comfort with saying yes or no. Last things here, there's LGBTQ specific factors with consent. So one thing I just really want to highlight that's important is gender identity. If we're having consent conversations with individuals who are like trans or non-binary, they may have very specific needs in regards to consent or heightened sensitivity with their bodies during exploration. This may involve more lengthy discussions on boundaries and desires. We could have a whole presentation on what that might look like, but incorporating a lot of what we've talked about here when working or having those consent conversations with individuals within that community, that can be something that's just super important for those conversations to feel safe. These are the last things. Again, these are less interesting. I'll just put these in the slides, send them to you. The legal aspects of consent, these can easily be looked up. These are what they usually look for. And certain factors that are important. It can vary state by state, but things like age and ability, intoxication, relationship, consciousness, all are things that they're looking out for. And this last slide, before I just ask questions, which we're not going to be able to get to, watch out for pressure, not taking no for an answer, and being swayed through guilt. We've talked about these things, but just as reminders. And then I just encourage that more of these discussions happen in sexual health education. I'd love more time, but we didn't have more time, so I apologize. But I know we're at 11:30. I don't know if everyone has to leave right this second, but I'm happy to take questions for a couple minutes unless everyone needs to go right this second.
Yeah, happy to be here for a little bit longer. Thank you so much for this presentation. I'm sad that we didn't get to the last bit.
That's okay.
But we'll definitely send out the slides. But yeah, if you have to head out, you have to head out. I linked our registration form for our advocacy day, which is on April 9th, to advocate for more comprehensive sexual health education that includes consent communication, on a statewide level in our schools. So if you want to show up to the Alabama State House and advocate for that, that's going to be on April 9th. And then I also included, I'll paste it again, our feedback form. So before you head out, if you could fill out that feedback form, that would be wonderful. And yeah.